Good morning. This is my mom. She's sick.
Needs to see a doctor?
Yes.
Does Mum have a Medicare card?
Let's go and see the doctor.
Okay.
Hi, I'm Dr. Lee. Mrs. Nguyen, tell me what the problem is.
This is my mom. She in pain, doctor. She can't speak much English, so I need to speak for her.
So tell me what has happened.
Last night she woke us up. She was complaining of a lot of pain.
Where's the pain?
The pain is here in her tummy.
Okay. What was your name?
Who?
Alright, Hoon, I need you to help me. I need to get some direct answers from your mom so that we know what's going on.
She's my mom. I always know what's going on with her.
Mrs. Nguyen, tell me exactly where the pain is.
I told you before, in her tummy.
Now, Hoon, I need you to help me again. Can you ask your mom to show me exactly where the pain is and when it started?
Mẹ chỉ ổng đi. Mẹ đau từ hồi nào rồi đau từ khi nào?
Cũng 2 tháng nay rồi. Mà sao sáng nay nó đau dữ quá à?
I told you it's in her tummy. She said the pain started 2 months ago.
Alright, I need to ask some important questions and I also need you to help. Mrs. Nguyen, have you already menopaused?
Ông nói cái gì vậy?
Can you ask something else?
Why? Is it too complicated?
It's not really the sort of thing Mom and I would talk about.
Now, I really have to ask your mom this. I need you to translate directly. Mrs. Nguyen, do you still have your monthly bleeding?
Mẹ còn kinh mỗi tháng không?
Thì có tháng không.
Yes, not every month.
Nè, con nói với ổng cho mẹ uống cái gì đỡ đau đi con.
She wants you to give her some medicine for the pain.
Before I can give you the medicine, I need to do some examination. I need to bring in a female nurse and I need to examine your uterus.
Ông nói gì vậy?
Ổng với lại cô y tá sẽ làm số xét nghiệm cho mẹ đó. If you have a female nurse, she will be okay.
Using family members or friends to interpret is risky.
Mrs. Nguyen, this is Sarah, one of our nurses.
The risks are inaccurate interpretation due to limited fluency in the language and poor knowledge of medical terms. Other risks include withholding or distorting messages due to emotional involvement, breach of patient confidentiality, incomplete medical history being given to the healthcare professional, inappropriate responsibilities being placed upon family members, and invalid consent to surgery or treatment. In addition, it can be difficult for the healthcare provider to communicate directly and build rapport with the patient.
Mrs. Nguyen, I do feel some swelling in your abdomen, so that's why I need to arrange for more tests.
Ông nói ông sẽ làm một số xét nghiệm cho mẹ nữa. What type of test?
It's called transvaginal ultrasound. We insert a probe through your vagina and we'll have a look at your uterus and the ovaries.
Ông nói cái gì vậy con?
Ổng sẽ bỏ một cái dụng cụ gì đó vô người của mẹ để khám cái bụng cho mẹ.
Mrs. Nguyen, I need to ask about your gynecological history. How many children do you have?
Ông hỏi mẹ có mấy đứa con.
Ủa con không biết làm sao mà còn hỏi.
She has 5 children. The oldest one and the smartest.
Mrs. Nguyen, how many times have you been pregnant? Have you had any miscarriages or terminations?
Oh, really? I'm sure it was just 5 pregnancies.
If you don't mind, we really need to know.
Ông hỏi mẹ có phá thai, nạo thai lần nào không? Con nói là không.
Thì đúng rồi. Đương nhiên là không có rồi.
She said no.
Thì sao mẹ ra máu nhiều dữ vậy?
You just examine her. Just tell me what's wrong with her.
Until we do further tests, we really can't say. She has unusual bleeding and some discharge from the vagina. which could happen prior to the menopause, but it could be something more serious.
Thì sao?
Ông nghĩ là mẹ bị tới giai đoạn mãn kinh á, cho nên bị vậy. Ông nghĩ là không sao đâu.
It is the doctor's duty to inform the patient of any condition they are suffering from. No one has the right to filter that information. However, family members often do filter the information, and the doctor simply doesn't know what's being said.
The purpose of the test is to rule out the possibility of uterine cancer.
Ông sẽ làm một vài xét nghiệm nữa, sẽ không có vấn đề gì đâu. Con biết mà.
When family members or friends are interpreting, it can be very uncomfortable for the patient to speak openly about their medical history, symptoms, or feelings they are experiencing. This patient had a number of terminations, but was reluctant to reveal this in the daughter's presence. The daughter was reluctant to interpret the test for cancer. In these situations, medical professionals never know what vital information they and the patient are missing out on.